Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.
You're listening to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. With us is Dr. Robert Popovian in Washington, D.C. He's a pharmacist, an economist, and the Chief Science Policy Officer at the Global Healthy Living Foundation.
And joining me is my very good friend, Ben Blanc, from the heartland of America, Indianapolis, Indiana, and our Associate Director of Digital Production and Engagement. Ben, we're on May 10th. This is a special time in Indianapolis, isn't it?
That's right, Robert. And actually, I want to remind our listeners that Indianapolis, or Indy, as we call it, is a four-season city, and something's always happening. But that's right, May is a special time of the year here as we're getting ready for the Indy 500, the largest single-day sporting event in the world. And I grew up watching Formula One on the weekends, so to me, this is gold.
Yeah, I'm more of a football guy, Ben, from our previous episodes, and also a soccer guy, but I'm definitely a major event kind of a person. And today we're talking about another major event that you and I attended last month, the World Vaccine Congress.
You were a presenter there, and you also moderated a few panels. So lots of learnings to share. Let's get to it. And as usual, I want to start this episode with a number, and I think a good number is 5,000. Can you tell us what this number means, Robert?
Well, Ben, you and I were there, and we were one of the 5,000 people who attended. It's the number of attendees that attended the World Vaccine Congress. That tells you how important this Congress is to the world of vaccines. Over 450 speakers, 300 exhibitors, and all of these people meet over a period of 4 days to cover everything vaccines, from research, immune profiling, clinical trials, manufacturing, access, everything under the moon that you can think of.
That's right. And it's also worth mentioning we're talking about a crowd made up of professionals from the industry, academia, other nonprofit organizations, and even government.
That's right. In fact, we had some representatives in the panel I was on from the government. So yes, they're definitely represented. That's what makes this an important program and takes to make the progress go forward on the vaccine space.
Well, let's dive right into it. So while we were at the World Vaccine Congress, we interviewed, and by we, I really mean you, interviewed, a few folks that we work with in the vaccine space.
That's right, Ben. And the first person we chatted with was Abby Bownas. So let's listen to the interview. So, Abby, we're doing a special podcast for our listeners on Healthcare Matters, and we're very glad to have you on this podcast. Why are you here? Why are you at the World Vaccine Congress? What are you going to be doing here?
I'm so excited to be here at the World Vaccine Congress, Robert. And today we're going to be talking on behalf of the Adult Vaccine Access Coalition, which works to improve access and utilization to adult vaccines, which unfortunately are, and as your listeners probably know, are far below where they could and should be. And so we're really trying to think about how we can improve those vaccination rates and what are the federal and policy opportunities to do so. So I have a panel later today with a number of experts, and we're going to be talking about what immunization infrastructure is, that idea of core programming and what all the different components are that really make up that one word that we like to use is infrastructure, whether that's the data and the safety, the actual vaccines, the education and the outreach, all those pieces that fit into infrastructure and what it takes to maintain that, especially in a post-COVID environment where some of those funds that have been around for the last few years are not going to be as free-flowing as they were over the last few years. So that's our topic of discussion today.
That is fantastic because, as our audience knows, adult vaccination, all vaccination for all people is a very important issue for us, but we're definitely not where we need to be as a society. And we're very happy to have you here at the World Vaccine Congress.
Yeah, and talking about not being where we need to be as a society with vaccination, that's a topic that we'll hear more about later in the episode. Robert, you also asked Abby, who you've known for a long time, to talk about her coalition, ADPC. So let's hear from Abby about what ADPC stands for and what she does at the coalition.
So the American Disease Prevention Coalition, or ADPC, has been around for the last few years trying to work to support the role of pharmacists as vaccinators. And what we see is that in different states across the country, while all pharmacists can vaccinate, the rules on how they can do it and which vaccines and their authority levels really differs in a major way depending on state by state. So we have a great group of advocates that are working together to really try to support pharmacy vaccination, because we believe that when the immunization neighborhood is strong and has all those partners working together, that we'll be able to boost immunization rates. And so that's the goal.
So the question I have for you is twofold, actually. Who are these partners? Because I believe it's a very broad coalition, unlike most coalitions that you see. It's a very broad coalition. But secondly, what is the main aspect of the coalition? What is it trying to accomplish? Is it state, federal? What are you engaging in?
Right. So it's a state-based coalition. The pharmacy, when it comes to kind of those authorities on how pharmacists vaccinate, the rules are actually made state by state. Interestingly, over the last couple of years when the pandemic was happening, HHS and the federal government actually created a broad acknowledgement of the need for pharmacists to vaccinate. And so there were temporary provisions put in place, and they're actually still happening until the end of this year, that really allowed pharmacists across the whole country to operate and vaccinate. And so in this time before that happens, we are trying to make sure that all states get their laws basically up to date now so that that can continue once those PrEP Act provisions expire at the end of this year. You had also asked about coalition partners, and we are lucky enough to have representatives from pharmacists and pharmacies across the country at the table. We have some of the vaccine makers and innovators that work on vaccines. We also have some additional patient groups, Global Healthy Living Foundation being one of them. And so we're really lucky to have a broad group of, I think, organizations that really just represent the value of pharmacists, but also just the value of having all partners that can vaccinate out there helping to improve access.
And, at Global Healthy Living Foundation, we're agnostic. We want our patients to be immunized as any way they can, but if they prefer going to a pharmacy by a pharmacist or a pharmacy technician to be immunized, or go to a physician's office, that's a great thing. But the reality is that we need to make access broad.
And I think that's a core component of this, right? And the idea is wherever you are, that it becomes the easy choice for that person to make a decision. A lot of doctors' offices don't stock or carry the vaccines. We want to make that easier for them to do so. But at the same time, if that physician's office is making a strong recommendation to get vaccinated, the person can then go to the pharmacy and access that vaccine. So it's a really nice, I think, collaboration between all of the providers to make sure that we are vaccinating.
That's right, Abby. Thank you so much for joining us.
Thank you.
It's so interesting what Abby is sharing here. And access was actually a topic on everyone's mind at the Congress this year, right? It's a broad subject, but that's definitely something that all the different actors who were part of the World Vaccine Congress debated, discussed, and formulated suggestions about. So now, the topic of policy barriers reminds me of an interview that you had with Dr. Thomas Acciani.
So yes, we spoke with Tommy, who was on one of the panels that I was participating in. And the topic was, how did we tackle the first combined flu, COVID, and RSV season? Alongside Tommy, there was a CDC colleague that was there and the National Foundation of Infectious Diseases. Obviously, Tommy works for GSK. He's the director of U.S. vaccine policy. So let's listen to his interview. So we are here at the World Vaccine Congress, and we're here with Dr. Thomas Acciani. So Tommy, tell us, what do you do at GSK and why are you here at the conference?
So I lead up the U.S. vaccine policy work at GSK. I've been at GSK for just a little over a year. Prior to that, I worked for HHS in the United States government doing healthcare policy. And prior to that, I was a research scientist for 15 years. But why we're here at World Vaccine Congress is kind of just to highlight some of the big policy barriers that exist that we're just trying to tear down with our public-private partnerships to basically just increase patient access. So that's really ultimately what it was.
What has stood out to you in this Congress since you've been here today?
Yeah, it's, I think actually your quote that rang true, I think the hardest was this Byzantine-like system that we have, and we put up these policy barriers for no reason, and we just need to take them down, and we're trying to work with that. We're trying to work with the United States government. We're trying to work with our advocates to kind of do this, to kind of highlight all of that. But ultimately, I think the thing we need to focus on is that there should be no wrong door to immunizations when it comes to vaccinations in this country. So wherever you have an activated patient, they should be able to get administered a vaccine right then and there.
Terrific. Thank you so much, Tommy, for joining us.
Thank you very much for having me.
Well, great interview, Robert. So, talking about barriers and access to vaccines, vaccine reimbursement plays a role here. Robert, you held a presentation where you presented GHLF's work over the past few years in the vaccine space, which was titled Medicaid Reimbursement in the Pharmacy Space. Do you want to tell us a little bit about that? And then we can listen to some of the excerpts from your presentation.
Sure. GHLF, we've done an array of studies over the years regarding immunization access. We've concentrated on immunization access in low-income communities. We've looked at where patients actually get immunized, which is overwhelmingly in the pharmacies these days by pharmacists being the immunizers. But this latest study, what we did, and we presented the data at the World Vaccine Congress, was looking at whether or not there's a correlation between reimbursement and vaccine uptake. And we used Medicaid reimbursement for flu vaccine as the example that we studied. And we looked at both the pharmacy reimbursement as well as physician office reimbursement. We did the analysis, and statistically speaking, there was a positive correlation in reimbursement and vaccine uptake or immunization at pharmacies, not necessarily a statistical correlation on the physician offices, even though there was a higher level of uptake as reimbursement went on in that space as well. But the moral of the story is that, look, Medicaid especially, the reimbursement is woefully low. And if we are serious about helping low-income patients, helping diverse communities, because and I've spoken about this, majority of Medicaid patients, they're overpopulated by racial and ethnic minorities. If we're serious about DEI and all these things, then we need to also be able to reimburse pharmacies and physicians at a higher level in that space to equal to what they get reimbursed, for example, on Medicare part. And that there is definitely going to help with vaccine uptake, which will then help these communities stay healthier.
Well, thanks for that overview, Robert. And now let's hear in more details what you had to say at the World Vaccine Congress.
So today I'm going to talk about background findings from the latest research that we've done, specifically the one that has to do with Medicaid reimbursement. And it's not just for pharmacy. We've also looked at the same study, Medicaid reimbursement for physicians. And then talk about policy research that we're doing, and then the future research that's going to come out in 2024 and what we're planning on doing in 2025. So our work at GHLF really started about 3 years ago. And one of our first initiatives, and my areas of interest, after I left Pfizer, I was there for about 20 plus years doing government affairs work and policy work, was to look at what is the vaccine access for patients in low-income communities. And why low-income communities? Because as you all know, low-income communities are overrepresented by minorities, and therefore it's an equity access for underserved populations. So we took a look at it, and this study was published 2 years ago in the Journal of American Pharmacists Association, looked at access to pharmacies versus physician offices that immunize. We used data from NCPDP as well as CMS to be able to identify these locations. And what we found out is that in low-income communities, there's better access for pharmacies and physician offices that immunize. But this access gets even more significant when you take into hours of operation, take into consideration hours of operation and ability to also administer the vaccine for Medicare patients, and has to do with the billing issue that goes on in the Part D space. Why is this important? Is because low-income patients generally don't have the ability to take off time from work during the middle of the day to go see a physician to get their vaccine administered. Therefore, having access at the pharmacy level is much more prudent and better for them. That was the first study that we did. Then the second study I was interested in doing, and we found a partner in IQVIA, the Human Data Sciences, to partner with us at Global Healthy Living Foundation, and we decided to look at where are patients, adult patients, getting their vaccines, specifically post-pandemic. We published this paper in 2023 in, as I said, in a collaborative effort with IQVIA. It was an IQVIA paper with the GHLF being a co-author. And what we found is that overwhelmingly post-pandemic, almost entirely the adult immunization was taking place in the pharmacy level, about 90%. And I know that a lot of the spike happened post-COVID because the COVID vaccine was being administered in the pharmacy. And the most recent example is the RSV vaccine. Over 80% of the RSV vaccines were administered in a pharmacy this last season. And my anticipation is that this is going to continue for adults in the foreseeable future, unless we do some policy changes that hopefully we will get into in our discussion in the panel. The other thing we looked at was racial differences. What we found out is that minorities are actually more often going to a pharmacy, which sort of confirmed for us what we had found out from our previous studies, that they're going to a pharmacy much more often to get their immunization than white patients. So Hispanics and Asians by far, but there's still an uptick of Black Americans who rather go to a pharmacy. And this confirms a lot of the studies that have been done in the past. So the next study we decided to do is the most recent one that we published a couple of months ago and had to do with reimbursement for pharmacy and physician offices regarding Medicaid patients. Why do we pick Medicaid? Why do we pick flu? Is because flu, number one, is universally being provided both in physician offices and in pharmacies, right? So that's the number one thing. Medicaid, because it impacts low-income communities, and we have very good data that we were able to get from the state programs that, we found out that what is the Medicaid reimbursement level, and we were able to correlate it with uptake in certain states. So we wanted to look at whether or not reimbursement level impacts uptake. Now, this is nothing new. There's been data out there for a while that shows that patients, when you provide better reimbursement, vaccination uptake improves. And this happened in the pediatric patients. And you see that the Medicaid patients are lagging behind either commercial or Medicare with regards to flu vaccination. So again, what we were trying to look at is that what happens if there's better reimbursement both in physician offices and for pharmacies regarding immunization going up or down in flu vaccine. Visually, it's very obvious. There's an uptick. You see there's a trend that goes upwards with regards to reimbursement. So reimbursement increases, uptake increases, or immunization increases. But us being economists, the three economists who wrote this paper, we had to do the statistical part of it to see if there's a statistical correlation to it. And what we found out is that there was a trend for physician offices, but not statistically significant. But there's definitely a statistical correlation between pharmacy reimbursement and improvement in vaccine uptake in Medicaid populations. The interesting part is that physician offices, there was a trend. It wasn't statistically significant, but still there's a trend that if you improve reimbursement, uptake increases in physician offices as well. And this has significant implications from a policy perspective because we're talking about Medicaid patients who are underserved, who have lower immunization rate than the commercial and Medicare patients. That one of the policy solutions that we can provide as a community, as a society, is to improve reimbursement in that space. The interesting part that also came up with me with regards to the study was that not all Medicaid programs in the states reimburse pharmacies to administer flu. About 4 or 5 of them are out there that don't allow patients who have Medicaid to go to a pharmacy to receive their flu vaccination, which to me is a bad idea, considering all the other data we've looked at with regards to access in low-income communities and where the adult patients want to go get their vaccines and everything else. So those were the studies that were interesting to us because it's a sort of a journey, as I said, and the policy recommendation is that, states should provide pharmacists immunization authorities similar to what physicians have. We need to come up with a better scheme than just lowballing either physicians or pharmacies about administering a vaccine. And what our recommendation is, frankly, to go up to the Medicare level. And what we anticipate seeing is that there will be an improvement in vaccination level. So to conclude our future research, as I mentioned, we just published the paper that you just saw in April 2024. Yesterday it came out. We had a press release. We have a podcast that has been done. Healthcare Matters is a podcast that I talk about a lot of the policy issues. About 50% of the time is vaccine related. The other 50% is PBM related. So if you have an interest in drug pricing and PBMs, listen to the podcast. You'll learn a lot, or hopefully you'll disagree with some of the stuff I have to say. The other thing that we're doing is that we're publishing a paper later this year with regards to immunization challenges, uptake challenges patients are facing. So GHLF is primarily made up of adult patients with chronic diseases that are immunocompromised. So we surveyed about 1,000 plus of our patients to see what are the challenges that they face regarding vaccine uptake, getting their vaccines. So think about it. These are all immunocompromised patients. These are all chronic disease patients. So for them, there should not be any barriers, right? They should walk in. They should be eligible for any of the vaccines that are out there for them. They should not have any out-of-pocket cost reimbursement. Interestingly, about 20% of the people who we surveyed had significant challenges accessing their vaccine. Part of it has to do because the pharmacists or the physician was confused about age requirements and whether or not immunocompromised patients qualify to getting that vaccine. So this has to go back to, we need to do a hell of a lot of education with healthcare professionals to get them around to understanding what are the exemptions that we put with regards to recommendations or stuff like that. The second part had to do with reimbursement, actually. A lot of patients told us that they showed up at the physician or a pharmacy and they had to pay up front for the vaccine and then get reimbursed for it, even though their net out-of-pocket cost would have been zero. How many people can imagine showing up at a pharmacy or a physician has to put out like $120, $150 and then they get reimbursed? A lot of people walked away. About 10% of the total 1,000 people that we surveyed, they just walked away. And remember, these are patients who are immunocompromised adult patients who are pro-vaccine and they're very motivated to get their vaccine. So having 100 patients just walk away from whatever vaccine they need, it's something that we're going to look into more with the survey, and we're going to publish some of the results.
Well, those were select segments of your presentation that you gave at the World Vaccine Congress, and you also moderated a few panels with several guests. Lots of learnings. I wonder if you could share with our listeners your main learnings from the World Vaccine Congress.
So, Ben, it's always exciting to be at this meeting, and you learn a lot about vaccines, and you hear a lot about vaccines that have been developed or being developed in the infectious diseases. But what stood out to me was all the vaccine research that's being done in areas other than infectious diseases. For example, there's a ton of research being done on oncology vaccines or other type of chronic diseases that is super exciting, and that's, I think, the future of vaccines. It's not just about respiratory illness or infectious diseases, but all of these other type of ailments that patients suffer from, that vaccine development may be a lifesaver or improve the quality of life or extend life. So our audience needs to keep an eye on this. We need to keep an eye on this because that's the future research that's coming. It far exceeds just the respiratory space and the infectious disease space.
Well, I like that word that you used, Robert, lifesaver. I think that sums it all. So thanks so much for breaking that down for us. And I think that was some very valuable information for our listeners. And to our listeners, don't forget to subscribe to our podcast on Apple Podcasts, Spotify, or wherever you might be listening so you never miss an episode. And if you have a second, help spread the word by rating our podcast, writing a positive review, and sharing with your friends and family. It'll help more people like you find us.
And as always, if you have any questions, comments, thoughts, please send it our way. An email's address is podcasts@ghlf.org. And, we're always looking for good ideas. So Ben and I scour through the emails and usually find one or two things that we want to talk about. And guess what? If we can reach out to you and perhaps we can bring you on as a guest on our podcast.
And before you go, make sure to listen to some of the other great podcasts on the GHLF Podcast Network. You can find all of GHLF's podcasts at ghlf.org/listen. He's Dr. Robert Popovian.
And he's Ben Blanc, and we'll see you all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.